uniform hand hygiene. Hi, Deontay. My name is Shaniqua. Nice to meet you. I closed the door for privacy. Are you comfortable?
Yeah.
Can you confirm your name and date of birth for me?
Yeah, Thompson, 12/27/2001.
Okay, Deontay, today I'm going to be doing a spiritual assessment on you. And basically what it is, we want to make sure we're looking at you as a whole person and knowing if you have any spiritual needs that we can incorporate in your care. You feel free to answer whatever's comfortable for you. If it's not comfortable, we can pass the question. But I just want to get a touch and base on, what spiritual practices you have. Okay? So my first question is, when you're going through something, who or what do you look to for support?
I first look for obviously my family, and then after that, definitely God.
Okay.
For sure.
And do you have any spiritual or religious beliefs? Going to church or?
Yeah, I try to make it to church frequently. Definitely would say I'm more like Christian, for sure.
Okay. Do you belong to like a certain spiritual community, like outside of church? Like, do you go to gatherings or anything?
No, I don't.
Okay. And do you practice anything outside of church as far as like journaling, praying, meditation to help you through?
Yeah, I definitely pray. I try to pray every morning, when I wake up and before I go to bed. Other than that, I don't think I'm, a part of anything else or anything like that.
Okay. Have you had any situations like with healthcare that makes you question your spirituality or your religion?
I think most of the time when I come into like hospitals, doctors' offices, everybody's big on like medication and things like that, where I try to like, rely on my faith, my God, and, prayer too. I think there's definitely like a balance for me.
Okay, perfect. So my question for you is, have you had any restrictions like when you're in a healthcare setting, like as far as diet, like some people might not eat pork or certain things, or anything in the healthcare field that we can do to help you more so stick to your religious beliefs?
Yeah, I don't eat pork or beef. Everything else is pretty cool. I eat fish, chicken, stuff like that.
Would you be interested in having like a spiritual advisor or a chaplain come to pray with you? Would you feel comfortable with that, or are you more like a private, private prayer?
Yeah, private prayer will probably work best for me.
Okay, if you ever change your mind, just let us know, or if there's anything that you want to bring up as far as restrictions or practices that you would like for us to incorporate in your care, just let me know. We can update that at any time.
Sounds great, thank you.
Do you have any questions for me?
Do you guys have a chapel here at the facility?
We actually do on the first floor, yeah.
Oh, cool.
And you can visit it. I'm not really 100% sure, but they'll have the hours posted, but you can visit it freely. It's open to the patients here.
That's great. Thank you so much.
Okay, Deontay. Thank you so much.
Yeah, anytime.
Nice to meet you.
You as well.
All right. Wash my hands.